Hello, gorgeous, and welcome to the Midlife Realignment. I'm your host, Esther Blum, and I'm here to disrupt the narrative on perimenopause and menopause with humor, nutrition, hormones, and fierce self-advocacy. Together, we'll rewrite your story and the rules because there's a light at the end of the vaginal tunnel. Let's go. Hello, gorgeous. Today on the Midlife Realignment podcast, I am here to do a solo episode with you to really unpack what's been happening with me post-hysterectomy, to really talk about the perimenopause journey and really what to expect, how to know you're in perimenopause, and how to really ask for hormones and advocate for yourself at the doctor's office. And by the way, if you haven't listened to my previous episode with Dr. Anat Sapam, you should absolutely go back and listen to it because so many of you have asked me about progesterone deficiency or symptoms of progesterone intolerance. And this is really Dr. Anat's wheelhouse. And we really took time to unpack it in the episode. So please, if you haven't listened to it, make sure you go back and don't miss it because it really is important context for this episode that I'm going to do. So in terms of my own perimenopause journey, it's been really interesting. My last cycle was May 3rd. It actually was brought on May 3rd, 2025. It actually was brought on after I did a psychedelic journey. And I was like, that fucker, my facilitator freaking brought on a cycle. And he was like, oh yeah, I knew that was going to happen. And it's really because we did a lot of clearing in the sacral space, in my sacral energy. And even during that journey, and I'll talk about the journey on a separate episode. It really warrants its own episode. But during the journey, I was in excruciating pain. I felt like there was a hot poker going through my left ovary all the way through my back, which is often what my cramps felt like 3 to 4 nights a week anyway. So I was just, and it came and went. It was very intermittent throughout the day-long journey. And then the next day I got a cycle because we really did a lot of healing energy and working through ancestral grief and all those things. So I asked my doctor, like, hey, am I officially going to hit menopause on May 3rd, 2026? And she was like, well, it's hard to know exactly because you had a hysterectomy. I had my hysterectomy in September 24th. So I'm praying that I hit it. Now, the interesting thing is I felt really, really incredible for a couple months after the hysterectomy. It was also warm outside. I was very active. I was out and about pretty quickly. And, I was pain-free and sleeping much, much better. So that alone was great. But then, perimenopause kind of kicked up all over again. And for me, my worst symptoms at the end were crushing fatigue and brain fog. And I am right back there again, if you can believe it. Now, it's been an ass-kicking winter, okay? I'm just coming back from a 2-week cold. Then I felt amazing and felt like my energy was back and my brain fog was gone. And then my son came home from spring break and I picked up that plague of whatever he and his friend who were visiting carried into my home. So it's all back to like scratchy throat, clogged ears, sinus congestion, all those things all over again. So I'm like, F me on that. But the interesting thing is, my doctor was like, let's run your bloods again because we really haven't run bloods since your hysterectomy. And what I wound up doing, so in terms of hormones, I still take 450 milligrams of sustained release progesterone at night. I take 2 milligrams of testosterone topically. And then my estrogen, we switched to a fem ring, which is a silicone ring that you insert vaginally and you just leave it there. You don't feel it, you don't notice it, but it's 24/7 administration of hormones. So I no longer have to deal with an estrogen patch, which is awesome. Now, we had to fight like hell with the FDA to get it because it's an $800 product. But for me, my pelvic floor issues are still there, and I get a lot of bladder irritability. And without that ring in place, I'm up peeing like 5 times a night, which is super duper annoying. And vaginal estrogen wasn't enough for me to combat these symptoms. I am going for pelvic floor therapy as well to kind of relax the pelvic floor and do some strengthening. But in the meantime, the Femring is just a great solution because I was having a ton of pain and burning in spite of using a 0.1 patch, in spite of using vaginal estrogen a few nights a week. I just had so much pain. And when I put in the Femring, within a day, all the pain was gone. So you can also use something called estring, which is vaginal estrogen in a ring that you leave in all the time. But again, it's low dose. So you would still have to use an estrogen patch if you needed systemic estrogen. That is a 24/7 vaginal estrogen only. And for me, it ran out after 8 weeks and it was supposed to last 12 weeks. So then I was sitting there in pain again, burning, bladder irritability all over again. And that's when I said to my doctor, like, can we move to the Femring? And she was like, yes. And it's the equivalent of a 0.1 patch. So I share this with all of you because I'm endlessly learning. This is obviously what I do for a living, but it's cool to be, the guinea pig for all of it, because then I can really speak authentically to all of you on, how things work in the body. And my body, I mean, the wind blows differently and my body's like, what's happening? What's going on? It's just hypersensitive and hypervigilant. The other thing I am doing is I'm using I don't have any compensation from them financially, but I'm using what's called a sensate. And that is vagus nerve stimulation. It's a teardrop shaped device that you put on your chest, like above your boobs, but under your thyroid. And you sync it to an app and it vibrates off and on. My husband, I'm like, I'm going to be putting a vibrating device on me. He's like, do I need to leave the room right now? But I do it before I go to bed, and it syncs with an app that gently pulses vibrations while you listen to music and meditations, and it really stimulates your vagus nerve. It's the equivalent of humming and going, and it really stimulates that vagus nerve. So that's been helpful. And the other thing we noticed now with my fatigue, I, went back to my GYM and I was like, what the fuck is going on? Why do I feel like the dead lady in the bathtub all over again? I was feeling so well and now I'm exhausted. Well, post-hysterectomy, removing the uterus, that really reduces your circulation to your ovaries. And so it does wind down the party. And so my DHEA plummeted. It was really robust before. It was like 125. She likes an optimal range around 100. Now it dropped down to 40. And I was like, oh my God. So I was previously taking 25 milligrams of DHEA. I've bumped up to 30. I'll do that for 2 weeks. Then I'll bump up to 35 and 40. Now, when I was at the last or 2 A4M conferences ago, I heard the awesome Dr. Pam Smith speak. And just thinking I should get her on the podcast too. Pam Smith was saying DHEA used to be you take the amount of milligrams as your age. So technically I should be on 55 milligrams according to Dr. Smith. I am going to ramp up slowly because my body's so sensitive. And if I bump up things too much, it messes with my sleep. For example, I was taking 5 milligrams of creatine to help with my energy. And what happened? I was like, why is it taking me an hour to fall asleep every night right now? And I did some research, and too much creatine can cause insomnia for some women. So now I'm back down to 2.5 grams of creatine. It's not interfering with my sleep at all, thank goodness. But also I'm praying that getting my DHE up helps with my energy. I've tried also bumping up my testosterone, and I feel incredible when I take like 3 milligrams, but what happens is I don't sleep. So it's a real delicate balance. And I think my adrenals are just shot from really, really inconsistent sleep for a long time and going through late stage perimenopause to menopause. And I've done a lot of things to support myself and reframe, restructure my business. I work in a very different way now that feels really amazing. But sometimes life is lifey and hormones are hormony. So we do the best we can with what we have. And I share this with you because you may be going through this too. I want you to know you're not alone. And never give up on the fact that there is a light at the end of the vaginal tunnel. Things do get better, but they are ebbing and flowing. We're humans, we're not robots. And so I have learned to give myself grace when I really feel bad or unwell. I have learned to always take things off my plate. I was talking to Nora Niederman, who was also on this podcast earlier. She was my second or third guest. I was talking to her this morning, and I said, I feel so crappy. She was like, what can you take off your plate? What can you cancel? And so I did. I am in a business mentorship, and I said, I need to put a pin in this until next week. I cannot get everything I need to get done this week. It has to be next week. And we do the very best we can with what we have. But listening to your burnout is really important, and filling your tank when your reserves are low and not taking on too much is also something that we can no longer ignore in midlife. It doesn't work. And if we ignore it, we'll continue to just fall deeper and deeper into an exhausted, depleted abyss. And nobody wants to be exhausted and depleted. So we have to surrender and rest. And yes, I've not been doing as much strength training lately. I've just been doing walking and stretching and resetting my nervous system. And it's okay. It's okay. So I really want to talk about how to even know when you're in perimenopause and how to know when it's time to bring in hormones. I've touched on this before, but it really bears repeating because there's so much information out there on social media, but we're not getting that information when we're at the doctor's office. And there's such a gap there. And it's really hard to be your own provider. So I want to teach you how to support yourself, but also how to get better support. All right. So how do you know when you're in perimenopause? Well, first and foremost, your menstrual cycle, if you're regular, is a beautiful barometer. It's really an important metric of your health and your hormones in particular. So progesterone, as we know, it's very robust the first half of our cycle. From day one of our period, it starts to rise until it peaks in the middle of the month. And then it starts to fall in the luteal phase, or the second half of our cycle. Progesterone is very calming. It makes, when we take it orally or in our body, it makes allopregnanolone, which then makes GABA, which is a very calming neurotransmitter, which helps us sleep, okay? And it helps opposes estrogen. So it helps prevent those crime scene periods we get. It keeps estrogen in check. If estrogen is the tiger, progesterone is the kitten. And so it keeps us from being hyper irritable. It helps prevent crying jags or like fits of rage. And again, if we're sleeping, we're going to feel so much better. So it just helps keep our moods calm and stable. And I remember when I started introducing it, I noticed like the PMS lessened so much more. And for a lot of women, the PMDD lessens, and also suicidal thoughts lessen. There was a study done on about 600 women who were given oral progesterone the second half of their cycle, and their suicidal thoughts decreased by 92%. I mean, my God, that is a game changer. So progesterone is really important. So if you notice the second half of your cycle, like things are out of control, you are super depressed, you're super enraged, you're super irritable and moody, your energy is very, very low, you're crying all the time, and your periods are super duper heavy where they weren't before, and you're getting clots and like changing tampons every hour, that is a sign that it is time to bring in progesterone. Now, in my 3 decades of practice, I've changed modalities over the years. And I used to give women chaste tree because chaste tree is a wonderful herb that helps your body produce progesterone in a more robust way. And if you are in your 30s and maybe you're postpartum or you're just having really bad PMS, chaste tree can really work. It takes about 2 to 3 months to kick in. Okay. But as you get into mid to late perimenopause, it's worth it to skip over that and go straight to the root problem, which is adding in progesterone the second half of the month, days 14 through 28. It can be an absolute game changer. Also, if you notice your periods are getting shorter or they're getting more widely spaced apart, you can bring in progesterone. Again, when would you bring it in? If your periods are a 21-day cycle, I would bring it in after day 11 to 12. If your periods are longer than 28 days, you can take it days 14 until you get your cycle and then stop the first day of your period. Okay, or you could take it days 14 to 28 and stop, and then you'll have like a withdrawal bleed. You can totally do that too. So, but if you notice that, you do that, you start bringing in progesterone days 14 to 28, and when you stop taking it, your sleep goes back to being erratic and you just don't feel as well. That's a time when you can stay on progesterone long term. Since progesterone opposes estrogen, it protects the uterine lining. So it's incredibly safe. And Dr. Anat talked about patients of hers that have been on 900 to 1,000 milligrams of progesterone. Now, when I'm talking about progesterone, I'm not talking about synthetic progestins. I'm talking about oral micronized progesterone that you can get from your pharmacy as Prometrium. It's covered under insurance. It comes in doses of 100 or 200 milligrams. And if you don't tolerate it, as Dr. Anat talked about, there are topical bioidentical versions of progesterone that she feels and has seen in her practice still protect the uterine lining. Synthetic progestins do carry more risks. So, but if you need them, they still also protect the uterine lining in a progestin-only IUD. It's very low dose, localized progesterone, right? And both are safer than birth control pills. But for some women, they just feel best on birth control pills. They've tried other things. So far be it from me to stop you. I just want to give you kind of a good, better, best scenario. But again, I have seen women do every different kind of hormone treatment, and you have to do what works for you. Don't only listen to me, listen to your own body, because you are your own best doctor. And even through witnessing my journey, I hope you see that there are moving parts, that what once worked for you in early perimenopause may not work for you in late perimenopause or menopause. Your dosing may be higher during perimenopause to combat symptoms and kind of tamp down the hormone chaos. And then you may be able to drop down. Like my hormones administration, I was on 2 patches at the end of perimenopause to control the hot flashing and to control my insomnia. And then I noticed, like after hysterectomy, I was getting very brain foggy and feeling worse. So we cut my hormones back and I felt much better. So again, this is why having a hormone literate doctor is so helpful. All right, but back to the basics. So changing menstrual cycle, that is your first biometric that you are heading down the perimenopause highway. This can happen in your 30s. You don't have to wait till your 40s or 50s to get support. You should start early intervention so that you feel better. You're more present in your life. You're connected to your loved ones. You are able to perform your job at work, and your cycles are not so debilitating that they take you down and ruin your life. For real, okay? Vasomotor symptoms, hot flashes, night sweats, vaginal dryness. These are all signs that your estrogen can be dropping. In addition to progesterone, progesterone also helps with hot flash control. but this is a sign you're in perimenopause. Okay. Um, Weight gain, slower metabolism. Slower metabolism often happens because we slow down too. When we're debilitated from exhaustion, we're not going to go be, pumping iron at the gym as easily or as well. Um, Certainly, hair loss, dry skin, breast tenderness. Like I noticed breast tenderness that was like I was pregnant when I was going through perimenopause and even starting hormones. I was like, ow. Well, why was I having that? Because my hormones weren't detoxing as well. When we're in midlife, right? As our hormones decline, we can develop a really sluggish liver. For some of us, even a fatty liver. So when that happens, our hormones aren't naturally moving down the right pathways. So we need to support our hormones detoxifying. For me, my cocktail is it's a cruciferous concentrate. I take glutathione and taurine. I take some liver supporting herbs and I detox like a freaking boss now. And all the pain went away. But again, it's different for everyone. Some women need B vitamins as well. Some women need magnesium and trimethylglycine. So it's very individual. But signs that you're putting on weight, you wake up 10 pounds heavier. You're like, I don't understand. I haven't changed what I'm eating. I haven't changed my exercise. I have to tuck my stomach in my pants every morning. All of those are signs that you're hitting the perimenopause highway. Um, in addition to physical changes, mood and cognition, okay? For me, anxiety was incredibly real. Now, you can argue that it was declining progesterone levels, but also there is a huge component of unresolved trauma. And when we hit midlife, our resiliency drops a tremendous amount, and that trauma we have not dealt with yet kicks us in the kishkas. I'm really excited. I'm going to have Dr. Sonia Jensen on in a couple episodes talking all about this, is the reckoning of trauma in midlife and what we need to do to heal it. And I could tell you, after my psychedelic journey, my anxiety really, really calmed down. But also, again, I really stopped menstruating after that. So I wasn't having as much of a roller coaster. But why do we have anxiety? Well, again, in the absence of or the decline of progesterone, we can really notice a change in our neurotransmitters and estrogen too. And testosterone, when our hormones drop, we really become very dysregulated. It's very easy to spiral. And I had cardiac symptoms. My heart was pounding all the time, especially at night. And of course, my doctor sent me to the cardiologist. I wore the Holter monitor. We checked everything and they couldn't find anything, right? So I was the classic case of like, well, your symptoms, we don't see anything, so therefore you're fine. I wasn't fine. I wasn't on an optimal dose of hormones. And sometimes we stay in this middle place because sometimes our bodies aren't ready for a higher dose of estrogen or don't feel well on a higher dose of progesterone. So sometimes we do need to endure a little bit of discomfort, but knowing your signs and symptoms, working with a provider, trying different things, now I never get heart palpitations at night at all. It's like smooth sailing. It's very calm. And I don't feel depressed or suicidal. I don't feel, like the world is ending. But it takes a lot to figure these pieces out. So writing down your symptoms, monitoring your symptoms, noticing, is there a correlation, tracking your cycles on an app? Is there a correlation between my symptoms and where I'm at in my cycle? When was the last cycle? Because here's the other thing. Because I'm not technically in menopause, right? I still have my ovaries. My ovaries can still be trying to have a cycle. And for a lot of us, even when we skip cycles, our bodies can still be trying. We just don't have enough progesterone to have a robust ovulation. But the ovaries, man, they're not giving up that fight. They're not going down without a fight. So we can still be struggling a tremendous amount with feeling really big mental, cognitive changes as well, and mood changes. And the cognitive changes can be, brain fog, really not being able to remember things, walking into a room, not remembering why we're there, forgetting dates, forgetting names, forgetting events on your calendar. I promise you, this does get better. It does. But there is, if you've ever read the work of Dr. Lisa Mosconi or seen the documentary, The M Factor, she's interviewed extensively in M Factor 1 and 2 and really talks about a massive dip in cognition and functionality in a woman's brain when she's going through perimenopause, and that eventually it does come back up. So some of this is waiting, some of this is early intervention, and definitely start tracking as you go along. When you go to the doctor for your midlife checkup, it's hard to know where to start. That's why I created my free resource, Top Hormone Tests Every Perimenopausal Woman Needs to Know. This is an incredible resource for you to download and use to get the best medical care possible and do a deep dive on what's happening in your body. Grab your free copy at estherblum.com. Sleep disturbances, of course, insomnia and night sweats, that's going to happen in perimenopause. And to me, insomnia and crime scene periods are the first things. You jump in and you get on progesterone. It will really make a difference. Of course, I cannot neglect talking about diet here. Dialing in your blood sugar is not even an option at this point. A lot of my clients wear a glucose monitor and they're like, oh shit, my blood sugar is dropping down to the 50s and 60s at night. Maybe I should give wine the old heave-ho for now. Maybe I need to bump up my protein. Maybe I need to have some fibrous carbs at dinner to tamp down my cortisol. Some of the insomnia too is a spike in cortisol caused by declining hormones. So if you notice dramatic sleep disturbances, whether it's the last 2 weeks of your cycle or throughout the month, or you're waking up many times a night, even if it's not hot flashes, you're getting more genitourinary symptoms of menopause, that's a sign it's time to get on that, get some early intervention. Joint pain and headaches are another huge symptom I see. Why is this? Because progesterone in particular, but also testosterone, but progesterone is a natural corticosteroid. It reduces inflammation. And even women in their 70s who've never started hormones before and get on hormones notice huge improvement in pain reduction and mobility. And testosterone helps as well. Testosterone really helps lubricate the fascia. And so we want to make sure that we're on a good hormone cocktail for that. Another change I see, and I'm itching my ears as I say this, itchy ears, increase in UTIs or bladder irritability. So UTIs, the number one treatment for this, and I'm so excited because the FDA is now talking about making this over-the-counter, is vaginal estrogen. So how do you use vaginal estrogen? Again, this is covered by insurance. You insert a pea drop amount on your fingertip. You go up inside the vestibule of the vagina, that's the canal, the main canal, and go front to back, especially where you're feeling dryness, but also in the labia minora and on the urethra and clitoris, because that prevents atrophy and it can really help with bladder incontinence. It can help with UTIs. Now, with UTIs, because there's a change in the vaginal microbiome, there's a change in the pH with a drop in estrogen. So putting estrogen back in can help restore the normal pH. Of course, I love D-mannose and probiotics for also help balancing the pH and preventing UTIs. Tart cherry juice or pomegranate juice, 2 to 4 ounces a day, help also make the bladder wall very slippery so E. coli cannot stick to it. And that can also prevent UTIs. But again, We want to think about diet, right? Low to no sugar and yeast, no alcohol. Be careful with caffeine. That's a bladder irritant. Be careful with fizzy drinks, seltzer. That's a bladder irritant. So we want to really make sure that we're dialing in on diet and lifestyle. Really, really important. Okay. So hopefully by now you're thinking, okay, I've got to track my cycle. I've got to track my symptoms, and I have to see what's going on, and I have to notice these changes in myself. I've got a good list. Now what do I do? Well, now you want to make sure that you book a separate visit to discuss hormones. If your doctor's hormone literate, the last thing you want to do is have a consultation when your doctor's face is between your legs or their fingers are inside of you, examining you, because they're concentrating on ruling things out, making sure your tissues are healthy, on making sure you don't have polyps. Maybe they're doing a breast exam. Like, that's where their mental real estate is going to be. So you've got to book a separate visit solely to discuss hormones. Now, here's the bit of tough love, and I'm sure you've heard me say this before. The doctor who delivered your babies, your OB, is not necessarily going to be the one who handles your menopause. Do not expect your doctor to be hormone literate. Well, how do you find a hormone literate doctor? Every state has at least one compounding pharmacy. You call the compounding pharmacy and you say, what doctors are running hormone prescriptions through the pharmacy? Who has really happy patients that you are prescribing hormones to or filling hormone prescriptions for? Who do you know who's really good? And they'll say, oh, your pharmacist should be able to give you a recommendation, which is really helpful. There are online platforms. I do not endorse any one specific one because I have frankly heard very mixed reviews. I will be honest. This is not to disparage, and I may change my mind in the future. But for now, I would proceed with caution if you want to do an online provider. And again, have these questions at the ready, okay? So first of all, make sure that someone is going to spend more than 10 minutes with you at an exam. And I would call the office and say, I want to specifically book an appointment to discuss hormone replacement therapy. That's number one. Number two, you want to ask, does this doctor know how to prescribe oral progesterone, topical estrogen, and topical testosterone, and vaginal estrogen? If they want you out of the gate doing pellets and injections, do not proceed forth. Why is that? I have plenty of women telling me online in my Instagram feed that they do well with injections or pellets, but the women I have seen in my practice typically, don't need anything that aggressive. Pellets are a very aggressive form of hormone replenishment. It's like driving a Kia, which is a perfectly fine, reliable car, and then getting into a Maserati. It takes you, when your hormones are at the end of perimenopause and in menopause, they're at a very low baseline. Putting in a pellet gives you a very high dose of hormones. You have no control over the release, and you are not able to remove them for months. So I have had many women in my practice come to me over the years who they went to see a provider, and the provider talked them into pellets. They lost hair on their heads, but grew it out of their chins. And they gained an average of 10 pounds, were feeling very enraged, and developed an enlarged clitoris, which sounds fun, but trust me, it's not. When you're hypersexual, it's very uncomfortable. It's not fun. I would only send my worst enemy to and tell them to get pellets. And even then, I don't think I would. Injectables are better because they only last about a week in your system. But again, they're far more expensive. I think about what is going to work long-term in a world where you're in your 40s or 50s listening to this and you're going to live another 40 to 50 years. If you're on hormones the rest of your life, they have to be financially sustainable too. Okay. So right now, estrogen patches, oral progesterone, estring and femring are covered under insurance. Vaginal estrogen covered under insurance. Men's testosterone is covered under insurance, but it's not dosed for a woman. It comes in like a ketchup packet. So you have to dose, I recommend people empty the packet into a container and then take like a syringe of, a pea-sized amount and then squirt that out on yourself and rub it in your skin. But again, the dosing is not precise. And so if you want it precise, you have to get it compounded, which is out of pocket, can be expensive. But, you are getting at least the proper dosage. Okay. So finding a hormone literate doctor, having someone who's going to spend time with you. Now, a lot of women say, what if I want to go through insurance? It's too expensive for me to go through a provider. In that case, you're going to need to be quite the advocate for yourself. Some GYNs and general providers really do know about hormones, and even endocrinologists really do know about hormones. They're hip to it. But in that case, arrive educated and informed. Number one, show your list of symptoms. Say, hey, I'm pretty sure I'm in perimenopause. These are the symptoms I'm having. Now, your doctor may automatically say, you're too young. That can't possibly be true, which is not true because it's happening to you, right? Number two, a lot of providers will say, well, hormones cause cancer. I'm not going to prescribe that because their literature is still not up to date. And I'm very thrilled to say I'm going to be speaking at the first of its kind Health and Human Services Conference in Washington, D.C., and I'm going to be on a panel talking all about hormones because we want this to get across mainstream channels. So if your doctor says hormones cause cancer, say, I'm curious, can you show me the studies that prove it? Because there are no studies that prove it. The studies have been done with synthetic hormones. That Women's Health Initiative was done with synthetic estrogens and progestins. Even though that study used conjugated equine estrogens, this was urine derived from estrogen derived from the urine of pregnant horses. Even that study showed benefits and protective effects against cancer from the estrogens. And we know this because there have been additional studies done with synthetic estrogens where women still showed benefit. The problem is the synthetic progestins, as I've mentioned. So regardless of that, you can be smarter than your doctor and say, from the research I've done, there isn't a single study showing that hormones cause cancer. In fact, there is a 60% reduction in breast cancer risk when bioidentical hormones are used. You can bring my book, See You Later Ovulator, into your provider's office. You can give it to your provider and say, I have research studies in the back of the book that show they're safe and effective. Number three, you could say, how about you let me try hormones for 3 months? I would really like to start with progesterone the second half of my cycle. The FDA has already approved these hormones, and even though it's not taught in medical school, these hormones are FDA approved. Would you please prescribe me? And then I would like to do some blood tests to follow up and see how I'm feeling. But for now, we can even start with my symptoms. Now, you may be thinking, Esther, what about testing? You're such an advocate of testing. Not all doctors test, and that's because your blood levels of hormones can fluctuate so wildly from one day to the next, and even within a 12-hour period, your hormones can fluctuate wildly. If it's going to be a huge barrier to get you started, just start where you're at, and then you can retest your hormones via blood after 6 or 8 weeks and just see where you're at. If your cycles are regular, you should be testing days 19 to 21 of your cycle. If your cycles are irregular, you can do days 1 to 5. You can test days 1 to 5 of your cycle. Okay. So ideally, when you retest your blood, you're going to want to test your estradiol. You're going to want to test your progesterone, your free testosterone, your total testosterone, your DHEA sulfate, and pregnenolone. Those are all really important hormones to test. If you're in perimenopause, you can also get an FSH and LH to see how far along in the process you are. But it's interesting, like my FSH, I'm one of those women who it just hasn't come up at all, even though I am 55 and in very late perimenopause. So, I'm like, I don't always push those tests anyway. But if your provider is unwilling to support you in this journey, if you're still not getting anywhere, if your provider says, if you're going to talk about hormones, I don't prescribe them and I won't see you anymore, which sadly happens to women. Or if your provider doesn't listen to you and says, no, this is just the way it is, have a glass of wine. Oh, you have low libido, just change sex positions. Oh, you have vaginal dryness, just put some lube on, which lube does not replenish your estrogen. It does not rebuild collagen in the vaginal walls. If you are waved off, if you are dismissed, if your gut is saying this sucks, this doctor isn't seeing me or hearing me, if you're in the parking lot after crying and calling a friend, like, fuck that. Go get yourself, figure out a way to go on a payment plan with a provider, put it on a credit card that you can pay off. I'm not here to tell you how to spend your money, but I am going to tell you, when you invest in a good provider, it will save you time. It will save you hassle. It will save you the frustration, and you will get proper medical care in perimenopause, because the alternative can be even worse. So figure out a way, talk it over to your partner. Here's the other thing I want to say. A lot of women, now I have had a practice a long time, women who work with me invest in their health, right? I do not, I have a cash practice at this point, and I don't even take on a lot of clients. I don't have the bandwidth. But the ones that do invest with me, and they always say, I need to, not everyone, but a lot of women say, I need to talk to my husband about this. Not always. Some women say they need permission from their husbands, which, guess what? No one's ever going to give you permission. No one is ever going to say, hey, here's a couple grand to invest in yourself this year in hormone care. No one's going to say it. So I always come at it from a place of partnership and say, hey, I have been doing the research. I'm in the freaking gutter. I have zero desire to have sex with you anymore, but I love you. I married you, but I am not myself. And my loins feel like the Sahara Desert right now, and I am not my best self, and I'm checked out, and I feel like a shell of myself. And I actually want to get back to myself. And that's going to actually require bringing in help and investing in my care. So will you partner with me in that? Because if not, I am not, I don't know how else I can come out of this. I need your partnership. Most people do get the support they need when they put it in those terms. And you also want to say what's in it for your partner as well. Like, hey, when you invest in me, you're going to get me back. Remember the lady you married? Remember that fun-loving girl who wanted to get with you all the time, who was randy, who had energy, who was joyful and not irritable, moody, and exhausted and not sleeping through the night? Well, I want to get her back too. Will you do this with me together? Okay? It shows you respect, honor yourself. Your partner will respect and honor you too. And the most interesting thing is, I've also found with women who aren't investing in themselves, it's not because their partners are the issue. The partners are supportive. A lot of women tell me, oh no, my husband will support me in whatever I do. It's really up to me. But they feel so guilty about investing in themselves. They have a low sense of worth. They don't think they deserve it. They think, oh, well, my kids are in college. I got to pay the tuition. I got to pay this. I got to pay that. And we put ourselves on the last rung of the totem pole, even though we are the glue holding together our families, right? We're running the wash. We're doing the schedules. We're doing the grocery shopping, and we're working, and we're taking care of aging parents. And we're still putting ourselves last. And that, my friends, is what is going to get us into that very depleted, exhausted, empty shell of ourselves. So it's actually non-negotiable at this point, because if you don't take care of yourselves, it's going to be wicked. And I don't want that for you. I want to make sure you get all the support you need. So it's kind of a non-negotiable, and it becomes, it's got to be the era of me first. You know, my son was just home for spring break, and we showed him Risky Business. And I love the character, the friend, Tom Cruise, Joel's friend, who's like, sometimes you got to say, what the fuck? Like, what the fuck? You've got to put yourself first. It's a non-negotiable. You do deserve it. You are important. And without you, like, your whole house wouldn't even run. So investing in yourself is very important. You can also try, if your compounding pharmacy isn't a good resource, you can try ifm.org, Institute for Functional Medicine. Now, I say functional medicine versus the Menopause Society. Menopause Society has trained a lot of providers, but still leans heavily on birth control, in my opinion. This is my opinion. And I've had a lot of clients come back to me and they're frustrated because they see a Menopause Society provider, but who's not functionally trained. So they're missing a lot of the pieces, right? Hormones alone, as much as I am a pro-hormone person, they don't fix all the things, right? Sometimes we've got to also look under the hood for adrenal issues, thyroid issues, lifestyle, stress, meditation, diet. So having a functional medicine provider can also be extraordinarily beneficial. Someone who's trained in functional medicine, if the hormones alone are not doing it. And again, this is why I wrote See Ya Later Ovulator. There's all the things on diet in there, and cortisol and stress management. Really, really, really important. So I want to leave you with a couple of books. And I hope, by the way, you play this and replay it. I hope you take notes or transcribe it. I hope you really pay attention, because these are tools that I teach to my private clients. These are tools that you will need. I hope you share this podcast with everyone you know, because the information in here is really, really, really critical. So read my book, See You Later Ovulator. The book Estrogen Matters is also by Dr. Avram Bluming. It is a cornerstone of what I teach, and the research in there is invaluable, especially, and he's an oncologist. So he knows a thing or two about cancer and hormones. There's also The Definitive Guide to Perimenopause and Menopause. There is The Menopause Brain. This is by Dr. Lisa Mosconi. And then my dear friend who's going to come on the podcast, Cynthia Thurlow, has The Menopause Gut coming out, which I can't even tell y'all how excited I am for that. So I'm so grateful you're here. You are already, if you're listening to this podcast, you're turning into a menopause ambassador. And, I would love for you to give this podcast and give the podcast in general a follow or subscribe, rate it and review it, share it with your people, and send me DMs on Instagram with any questions you have, because what questions you have, I will always answer in the podcast. So appreciate and love you all. Thank you for being here. Thank you for listening, and we'll see you next week.
If you loved this episode, follow or subscribe to the Midlife Realignment wherever you listen to podcasts and on YouTube, and leave a review to help other women find this show.